Good morning, everyone. I am Dr. Pallavi, and I'm a consultant nephrologist working currently in Jammu. And today we'll be discussing a very important topic, that is pedal edema and CKD, its causes, symptoms, and associated treatments. So again, I welcome you today to this session. And today we'll explore what pedal edema is, its causes, how it relates to CKD, and the best way to manage it. First, let's see what pedal edema is. Now, pedal edema is a condition where extracellular fluid accumulates in the lower legs and feet, causing them to swell. The swelling can happen for several reasons, such as heart problems, liver issues, thyroid issues, kidney problems, or blood clots. Our body fluids are divided into two main areas, which is inside our cells and outside them. So the outside areas include the space around our cells and also inside our blood vessels. Now, edema or swelling, what we call it in layman's language, occurs when there's a problem with how fluid are distributed between these areas. Now, this problem can happen if too much pressure builds up in the blood vessels, often due to heart issues or excess fluid. It can also occur if there aren't enough proteins in the blood, like albumin, which helps keep fluid in the vessels. Additionally, the lymphatic supply normally helps move fluid, extra fluid, and protein back into the blood. But if this system isn't working properly, the fluid can build up and cause swelling. Now, the kidneys play a very crucial role in regulating the fluid balance. Now, kidneys help remove waste and regulate fluid. And when they are not functioning properly, this fluid can accumulate, leading to edema, as seen in CKD, also in AKI, or in some conditions like nephrotic syndrome. Now, edema is one of the major symptoms of CKD. Now, let's explore how clinicians approach and diagnose edema. First, a delayed history helps identify risk factors and underlying conditions like heart failure, kidney disease, or thyroid disease. Now, edema can be generalized or localized. Now, generalized edema is the type which affects the entire body or the large areas and is often linked to conditions such as heart failure or kidney failure. Now, localized edema, on the other hand, is the type of swelling in just one area of the body, and it's often due to inflammation, which also may be because of blockage of lymph fluids or issues with the blood flow in the veins. Now, during the physical examination, a clinician looks for pitting edema or a non-pitting edema. Now, a pitting edema is indentation after pressure, indicating heart failure or a nephrotic syndrome, whereas a non-pitting edema suggests lymphatic obstruction, hypothyroidism, or may be seen in other conditions like cellulitis. In the case of kidney disease, the following lab test and imaging can be helpful to a clinician. These may include CBC, renal function tests that include serum urea and creatinine, urine analysis to see for any protein loss in the urine microalbuminuria, and again urine albumin creatinine ratio to see for any protein loss. As well as we can do an ultrasound of abdomen and pelvis. A thorough history of physical examination are the main key to diagnosing edema. Now, identifying systemic causes and specific sign guides the management plan further. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, a non-pharmacological treatment are essential alongside addressing the underlying issue. But whereas for a systemic cause, a combination of general measures and targeted treatment is needed. Now, for localized edema, non-pharmacological measures include first the limb elevation. Now, regularly elevating the affected limb may help reduce your swelling. The second therapy may include a compression therapy. Now, wearing compressive stockings can assist in improving blood flow and regulating your edema. Thirdly, physiotherapy. Now, massage and other physical therapies should be performed by a trained professionals, and this also might help. Fourthly, ice application. This is usually useful for severe or congested edema and also in cases where there's infection and cellulitis. In cases where systemic causes are at play, such as CKD, the treatment focuses on reducing fluid retention and addressing the underlying condition. And these include, firstly and most importantly, salt restriction. Not limiting your salt intake helps prevent fluid buildup and manage volume overload. And mostly it is recommended to keep a salt intake of less than 2 grams per day. Second is the group of drugs known as diuretics, and these medications increase urine output to help manage the fluid levels. Now, there are different types of diuretics available to us, and firstly, there is loop diuretic, and these drugs may be like furosemide or torsemide, and these are often preferred for their effectiveness and long duration of action. The second group is thiazide diuretic, and the example is metolazone or cyclochlorothiazide, and these can be used adjunctively with for enhanced diuretic effect. Third type of drugs are the potassium sparing diuretics like spironolactone or aldactone, and these are to be used cautiously due to high risk of hyperkalemia with these drugs. The choice and the dose of diuretics depends on factors like severity of edema, the patient's hemodynamic status, and the kidney function. Now, it is important to use diuretic cautiously to avoid complications like hyperkalemia, hypotension, and electrolyte imbalances. Now, regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic tests is essential with these drugs. In chronic kidney disease, managing edema often requires first salt and fluid restriction, as we have discussed, and it is essential to control fluid retention. And second, high dose of diuretics like tooth diuretics like furosemide are usually effective, but thiazide diuretics can also be added if necessary. Managing edema is a tailored approach. So, for local causes, non pharmacological treatments are key, and systemic causes require dietary adjustments, diuretics, and close monitoring. Patient education is also very crucial, and understanding the condition, following the treatment plan, and making lifestyle changes can improve outcomes. So, early recognition and effective symptoms management also prevents complication. So, join us in recognizing National Edema Awareness Day to increase awareness and promote early detection of edema and related conditions. Together, we can manage and understand edema better. Thank you.